Good morning, good afternoon, good evening, wherever you may be listening in from. Welcome to Onwards and Upwards, where you learn everything that an international global healthcare worker needs to know about living and working in the US. So, thank you for joining. My name is Deirdre O'Regan. I will be your host today. I am the Senior Director of Recruitment at AMN International. I missed you all last week. I was on vacation. I took the opportunity to go and visit my family in Ireland, which I greatly enjoyed. The weather did not cooperate. It was raining the entire time, but always so great to spend some quality time with family. So we have got a great show for you today. I am so excited. We have got some wonderful guests who are going to tell us all about the amazing health system of Mercy, which is located in a number of different states. But what we're going to focus on today is talking about one particular campus in Mercy South, and that is located in St. Louis, Missouri. So we are joined by the Mercy South leadership team, who I will introduce shortly, and they will tell us all about what it's like living and working in the beautiful city of St. Louis, Missouri. You will learn all about what the onboarding process looks like at Mercy South and why you should look at the amazing opportunities that are there for you. We also have the pleasure of having one of our international nurses who is working at Mercy South join us today as well to talk about her experience right from the initial recruitment stage right until she arrived in the US living her American dream. But before we get into that, let's pull up our success path. Many of you will be familiar with this, and this is where it all starts. It all starts with that all-important NCLEX. So make sure that you have passed your NCLEX. If you are on this call today and you have passed your NCLEX and are working in an acute care setting, we want to hear from you. So please make sure that you are applying today at AMN Healthcare /international. Our expert recruitment team is on hand, ready and willing to help you. So once you have passed the NCLEX, our team helps you through the immigration stage and any licensing and credentialing that is needed. And we also help you get ready for your arrival here in the US. So that includes relocation, anything associated with that. And we also prepare you for orientation at your facility. And then guess what? You're living your American dream like our nurse Theory is going to talk about with you today. So we also like what our favorite thing to do on these shows is to see where you're all calling in from. So please make sure that you are putting in, I see Mandy from South Africa. I see Doris from Ghana. Welcome, welcome. We love to see where you're calling in from. I see Abu Dhabi. I see the Philippines. So this is very, very exciting. I know that you are very excited to hear all about what we are going to share with you about the Mercy Health System, in particular, our Mercy South campus. So without further ado, hi, Arlene from Jamaica. Thank you so much for joining. So without further ado, I am going to welcome our esteemed guests today. So if we can let our guests in, we are joined today by Leah Jansen, by Mark McAteer. And I know that Nurse Theory is having a little bit of technical difficulty getting on today, which I think from the last week, we all empathize with that. But she will try her very best to get on here, and hopefully we will have her shortly. So we have Leah Jansen, who is Executive Director of Critical Care. And we also have Mark McAteer, who is Executive Director of Medical Surgical. So I will hand it over to Leah to give a brief introduction, followed by Mark, and then we will get started. And hopefully Nurse Theory is able to join. Oh, there she is. Hi, Theory. Welcome, welcome. Thank you so much. Over to you, Leah, a brief introduction, and we will get started.
All right. Hi, everybody. Good morning. My name is Leah Jansen. I'm the Executive Director for Critical Care here at Mercy Hospital South in St. Louis, Missouri. We have on our team a couple ICUs, step-downs, dialysis, and a clinical decision unit, and a wonderful team of leaders and international nurses are on our team as well.
Wonderful. Thank you so much, Leah. And we truly appreciate all of you taking the time to talk to our guests today, to talk to our audience. Love hearing about a particularly Mercy Health System. We have worked together for many, many years. Very, very fortunate to have the opportunity to work with these amazing leaders, and of course, our international nurses as well. So, Mark, if you would like to introduce yourself, and then we will have Theory.
Yeah, so my name is Mark McAteer. I'm the executive director of the Med Surg service line. In that service line, we have oncology, neurology, heart, general surgery, surgical recovery, so many options. Again, as Leah said, a lot of great leaders, a lot of great international nurses. So we always look forward to having our international. We've built a pretty great team around supporting them and getting them where they want to go. So thanks for having me and appreciate you being with us.
Thank you so much, Mark. Appreciate it. Thank you, Leah. Theory, would you like to give a brief introduction to our audience?
Hi, I'm Theory. I'm currently working in Mercy South at surgical step down unit. We basically handles like a lot of surgical cases, but sometimes we do have overflow cases from other discipline as well. And in my like floor, I do works with a lot of international nurses, and it was like very exciting and very friendly environment to work with. And yeah, thank you for having me here
Thank
today.
you for joining, and we're excited to hear about your experience working at Mercy South with these alongside these amazing leaders who are joining us today. So Theory, let's start with you. Why did you decide to become a nurse in the U.S.?
Okay, so from the start, I was originally from Burma. Then I studied and worked in Singapore for like 14 years. So I have been a nurse for 14 years. And I have like research, I read a lot about nurses, and I'm sure like the nurses in US have a lot of autonomy, authority, and a lot of things that can be done as a nurse rather than the bedside nursing and, just like caring of the patients, cleaning up and stuff. So it's one of the reasons to have
Perfect.
to live American dreams as well. And yeah, I mean,
Amazing. And I know that everybody on this call today is either in the process of starting their American dream. They may be in the middle of it, or they may already have done it. So thank you so much for sharing your experience with us. I know that it's going to be very helpful to all of our listeners in either making that initial decision or keeping them motivated. Right now we're in retrogression, we know. So you are a testament of if you just have patience, continue to stay motivated, it will work out for you. So Mark, can you tell us a little bit about where in the US is Missouri located for our listeners who are not quite sure?
Yeah, so we're located in the Midwest, so kind of the central part of the United States. We border Illinois exactly, pretty close. I personally live in Illinois. I drive to Missouri, so you can kind of get a feeling for how close we are. So right in the center of the United States.
Wonderful. And we hear that a lot, right? So if you're interested in going to a particular location, a particular state, the beauty of the United States is that in many, or said there's many bordering cities and states that you can actually probably commute to faster than if you were actually living in that location. We heard that as well. We know that one of our team members actually works in Dallas but lives in Oklahoma City and does that commute. So just very interesting. Make sure that you're doing your research on locations and the proximity to the area that you are interested in. Leah, can you talk to us a little bit about what attractions are there in Missouri? I know myself there are a lot, and we won't have time to get through everything, but maybe the top 2 or 3 that you would recommend to our audience.
Yeah, so what's closest to us in Missouri, we have the St. Louis Arch. We're the gateway to the west. And St. Louis has done a really good job of updating those arch grounds down by the arch. I think there's a picture of it somewhere. Yep. There's the Botanical Gardens that's on the picture there, the St. Louis Cathedral. Those are really good attractions. the History Museum, what else? Science Center, the brewery, the Fox. There's just so much to do. If you're bringing kids with you or spouses or partners, there's so much to do around. Specifically down at St. Louis Union Station, there's a big Ferris wheel and an ice cream shop, and there's all kinds of stuff down there, and they make it a really good, fun time of year around Christmas, and they decorate it, and they have the Polar Express and a bunch of Christmas lights too. So there's tons to do.
Oh, wow. I'm marking my calendar for holiday time and go see that. Big Christmas favorite time of the year. And, just love to see the festivities and all that great stuff. So thank you so much, Leah. Theory, can you tell us a little bit about where you're currently living and what you like to do there? What's your favorite thing?
Okay, I'm currently living down in St. Louis. So it's where the Great Arch is located. So apparently, I just went to the Grants Farm like last week because I love horses, and I saw the Clydesdale there. They are really awesome. They were really awesome. And another thing, my favorite was I think last month there was a Shakespeare's in the Glen, so it was a new experience to me. Like the Shakespeare shows were like free, and it was in the like open theater in the Forest Park. It was a very good experience for me as well.
Wonderful. Okay, thank you. Yeah, the Clydesdales, at every Super Bowl, that's one of my favorite commercials, right? When I have the Clydesdales, I think that it's everybody's favorite commercial. But to see that in person must be
They are
cool.
huge.
They're huge. I'm sure they are. I'm sure they are. But what a great experience for you to have seen that in person, Theory.
Yes.
Mark, can you tell us a little bit about the cost of living in Missouri?
Yeah, sure. So comparable to the United States, we're in the lowest cost of living areas across the nation. The Midwest tends to be the lower cost areas. But if you want to get more specific around the St. Louis area, kind of the closer you get to the St. Louis city, you might pay a little more. But there's a lot of different towns around St. Louis that are easy to commute to. So when you are looking for housing, do your research. Getting as close to the hospital is not always the most ideal, and being super far away from the hospital can get kind of expensive too. So really look into what areas you're looking at, because the cost of living does vary as far as living expenses for those different options. But in general, gas, living expenses were one of the lowest in the nation.
Perfect. Thank you. And I know that that's a key decision maker for all of our nurses, is looking at how much is, again, Theory's nodding her head. Absolutely. Those are things that, especially if you're bringing a family, are very important to consider. The beauty of the U.S. is that it's got major metropolitan areas, and it also has your more rural areas and everything in between. Right. So it's really important that when you're making a decision, that you are really factoring in the expenses, the housing costs, food costs, childcare. All of those things are going to be very important. And while you may want to live in a large city, just understand that that's going to cost you more. And sometimes those smaller cities, those smaller locations, particularly when you're starting off, are probably going to be the better option for you. But that's why you want to work with an organization like AMN Healthcare International, is because we're going to help guide you in making that right decision. I know you all know this, but we are the only organization that offers both direct and staffing. So we want to help you make the right decision for you and your family. And there are 50 states, so we want to make sure that that you are making the right decision, and that when you do arrive here in the U.S., just like Theory, that you are thriving and prospering. And I'm sure that Theory was looking at other opportunities, and we'll get to why she chose Mercy South here in a little bit. But just I would encourage you all to be open, to do your research. And if you are looking to get your I-140 filed in 30 days or less, our staffing opportunities are going to be a great option for you, which is what our Mercy South opportunities are. So Theory, one of the things that we are always asked, and I'm sure you asked the same before you made your decision, is talk to us a little bit about the weather.
Oh, okay. The weather here, when I reached here in February, it was cold and chilly, but like at this timing, it's kind of hot and humid. But from what I researched and from what my friends said, it's getting cooler like at the like mid to end of September. So you can like, and I was told that during the fall, the city, I mean like the place is really awesome and beautiful, so like I can't wait for it. So it's one of the reasons why I come here, is that I can enjoy all the four seasons, but not much snow, so it's not going to be hard for me. I came from the tropical country, which is hot, so I don't think I'm ready for the like snows and cold right yet. So this is the best place for me so far. Yeah.
Perfect. So you get to witness the four seasons, which is beautiful, right? So you have the fall. I know that that's one of everybody's favorite seasons, is that you get to see the leaves change and the colors and all that beautiful stuff. So sounds like you acclimated pretty well to the climate and the weather. And coming from a tropical country, that's not always easy, but it sounds like this is the perfect location for you. It doesn't have extremes. Right. So great. Thank you so much. And you can always bundle up for the cold, right? So jacket, sweater, whatever that may be. So thank you, Theory. Leah, can you give us a brief overview of the Mercy Health System? I know today we're focusing on Mercy South and the amazing opportunities that we have there. But I'm sure the audience would be interested in just a brief overview of the Mercy Health System in general.
Yeah, I sure can. But before I do that, I have to share a story about one of our international nurses. She was on one of the cardiac step downs, speaking about the weather, and it was starting to get cooler. It was over the winter. This nurse was also from a tropical climate before she came to St. Louis, and she had never seen snow before. And at the end of one of our hallways, there's this really large picture window that's like the size of the entire like floor to ceiling. And she was standing in front of it during the middle of her day, and it started snowing, and she just started sobbing because she never saw snow before. So the team rallied around her and got her all bundled up and watched her patients for her and whisked her outside so she could feel the snow and see it. And that part was really magical. So I'll always remember that. So I wanted to share.
Thank you for sharing that, Leah. And you don't know how many times that we hear stories like that from our international nurses who are working in the Mercy Health System. It truly is. You have created an international community that is like family. And I know that when we have the opportunity to go on site and meet our international nurses there in person, and of course the leadership team, we come away with just the most warm feeling. They are so happy, they're so connected, and it truly is just a testament of the program that you all have built in the Mercy Health System. And I know that our international nurses, once they go there, they certainly do thrive and live the American dream, like Theory is a testament of today. So thank you for sharing that. We love when we get to hear great stories like that. But I'll give it back to Leah just to give us a brief overview of the Mercy Health System.
Yeah, so we have over 40 hospitals and acute care facilities now. I think over 40,000 employees. 42,000, look at that. Okay, 44 hospitals, wonderful. We're kind of spread across the Midwest, and we are ever growing. We are the 7th largest Catholic healthcare system in the United States, and it's also a non-for-profit system as well. So we keep expanding and growing and creating our footprint across the Midwest.
Wonderful. Thank you so much, Leah. And, just like we have international nurses who are tuning into us today to hear this wonderful information, we also have some internal team members. And I do want to read out one of the comments that one of our internal team members, Kim Spellman, I know that many of you on this call probably have spoken to Kim at some point, but Kim said, "I love Mercy Health. This team forever wraps their arms around our international healthcare providers. You have created such a welcoming, safe place for them to start their lives and practice here in the US. Thank you for all you do. I could not have said that better than Kim, so thank you, Kim. Kim is a master of words, and I know that many of our international clinicians who are fortunate enough to be able to work with Kim truly appreciate her. So thank you so much, Kim. Mark, so we talked about Missouri and where it's located. Can you talk to us a little bit about where Mercy South is located?
Yeah, so we're located at South County. We're about 20 minutes from downtown St. Louis. So very close to everything, really. So Mercy South has that small town feel, but we're a large hospital and we see everything. So, I think one of the benefits of working here is you get that, I know this sounds kind of lame or cheesy, but you get that great parking, which is important to a lot of us. But also you get a really high level, high functioning hospital that has a community of international nurses that we truly support and we want to grow. So it's just a great area to work in. A lot of things going on, but you're close to everything. Everything is very easily accessible, and there's so much to learn here. So just an overall great place to work.
Perfect. Thank you so much, Mark. And Leah, can we touch a little bit about awards that the Mercy Health System has achieved?
Yeah, sure, no problem. We are maybe almost most proud. We are a comprehensive stroke center, which is the advanced level of accreditation for comprehensive stroke. We're one of the few hospitals in the area that has it. So our stroke and neuro programs are expanding and incredibly established. We're level 2 trauma, level 1 STEMI. We do have a AACN Gold Beacon Award for Clinical Excellence and Patient Experience in one of our ICUs. We're very proud of that. We are going to engage into a Pathways of Excellence program this coming year moving forward. Let's see, we are Joint Commission accredited and the Gold Seal of Approval there. The AHA, Get With the Guidelines. We do have Heart Failure Gold. And then we are Leapfrog Grade A, which is a huge testament to our clinical excellence and patient experience.
Wonderful. Thank you so much, Leah. So lots of great awards achieved by this very prestigious health system. And so those are the things that you want to look at when you're choosing where you want to start your life here in the US. And this is an amazing opportunity to work with these amazing leaders, not just Leah and Mark, but across the entire organization. Just like we said, they've built an international community that is like family. So it's your home away from home. And you want to make sure that you are applying today. If you have not already, we'll put up that handle again, AMN Healthcare /international. Again, we are the only organization that provides both staffing and direct hire opportunities. And advice to you is if you want your I-140 filed quickly, I would be looking into our staffing opportunities, of which Mercy is one, and we look forward to helping you expedite your application to the Mercy South campus. So our international nurses, Mark, have many opportunities. Why should, in your opinion, should they choose Mercy South if given the opportunity to do so?
Yeah, and you're right. In the St. Louis area, there's a lot of different opportunities, a couple different health systems, but and many of us have experienced those health systems and have found our home here. So what we offer here, we're a faith-based organization. We're a community hospital. I think one of the great things that I learned when I arrived a couple years ago was, our president, Sean Hogan, he doesn't live too far from here, nor do any of my coworkers, the people that we treat. The people that we're treating in this hospital are our neighbors, are our friends, our community, people we see at church, people we see on the weekends. So you really have that true feeling of passionate care. So that was always important for me. And kind of like I said before, we've grown an international community here. We've gotten really good about onboarding international nurses and making sure that they're not just within the hospital that they're successful, but outside the hospital. What's their living situation? Are they getting childcare, education? So really, that's a great reason to work here. We've kind of set up a whole functioning system to help support international nurses, but also in a community hospital that's very, very busy.
Wonderful. Thank you, Mark. We've got a lot of questions coming through in the chat. This one is for Leah. So Leah, your critical care unit, in terms of your patient's profile, example, is it a cardiac ICU? What kind of ICUs are there at Mercy South?
Great question. Thank you to whoever put that in the chat. We have several ICUs. We have a CVI, so cardiovascular ICU. We have a cardiac medical ICU, so that's part of our CVI. And then we have a neurotrauma ICU.
Perfect. So Sabanda, thank you so much for asking that question. Any other questions, please make sure that you are popping them into the chat. The Sanover, when will the interviews be? So once you submit your application, let me just tell you a little bit about the process. Once you submit your application, it is reviewed by our recruiters to ensure that it meets the qualifications of what the Mercy South team is looking for. If it does, then our clinical team will review and approve that, and we will submit to the Mercy hiring team. So it may take a little bit of time to facilitate some interviews, but then you do interview with the hiring leaders. It may be with Leah, it may be with Mark, it may be with another hiring leader at the Mercy South campus. And then if it's a good match, if your experience matches what the Mercy South team is looking for, then we will go ahead and get that processed for you and start your immigration process. So before we go back to Theory and ask why she chose Mercy South as her location here in the US, we want to do a fun little quiz. So we got a couple of questions. So here we go to ask the audience to participate. Put your A, B, C, or D answer into the chat. And hopefully our panel can help us with the correct answer. So the first question is the Blank Arch in St. Louis. And if you were listening to Leah earlier, she did talk about this, is the tallest man-made national monument in the United States. It stands 630 feet tall. So is it A, Keystone, B, Gateway, C, Crown, or D, Roman? I see a lot of B's coming in. Lots of B's. Thank you for your participation. This is fun. We like to have some fun. Okay, so everyone said B. Let's pull up the correct answer. Is it? Yes, it is indeed the Gateway. So you were listening to Leah when she mentioned that a little bit earlier. So thanks everyone for playing. We've got a couple more questions and then we're going to get back to Theory, and we want to be very respectful of everybody's time. So these shows can go on for more than an hour, but we certainly want to be very respectful of our panel's time. Okay. Blank city is the capital of Missouri. Is it A, St. Louis? Is it B, Jefferson? Is it C, Kansas? Or is it D, Springfield? Okay, so let's see. We've got we've got A. Thanks, Arlene. Jose thinks it's A as well. Pretty thinks it's B, Jefferson. We got some B's here as well. So it's a tie between St. Louis and Jefferson right now. So our audience thinks it is A or B. All right, let's pull up the answer. It is Jefferson. So nice job to everybody who guessed B. So nice job to everyone. Thanks so much for participating. This is our last question before we get back to Theory. This one's a little bit of a trick one. Well, maybe not, but this sports star plays for Missouri's Kansas City Chiefs, who are Super Bowl champions for 2 times in a row. Keep me honest, Mark. I don't want to say 2 times in a row, going for the 3rd one this year. So a big Kansas City Chiefs fan right here. The football team that took home the Super Bowl trophy this year. A hint is Taylor Swift is his #1 fan. So is it Patrick Mahomes? Is it B, Jason Kelsey? Is it C, Travis Kelce, or is it D, Rashee Rice? Okay, so Waddy thinks it's Patrick Mahomes. Let's see. All right, so do we think it's A, B, C, or D? All right, the answer is C, Travis Kelce, who I didn't know until Taylor Swift, but there we go. Yes, the Taylor Swift, if you haven't been to her Eras show, amazing, amazing. And you may get to see Travis there. He sometimes tends to show up unannounced. Okay, so Theory, back to you. Thanks for participating in our little quiz there. Always so much fun. Theory, so going back to when you applied with AMN Healthcare International and started your process and began interviewing with U.S. facilities, why did you choose Mercy South?
Okay, I got like a few offers and interview, but I chose Mercy because whenever I get the interview, for me personally, like I will Google it, I will do some research, what kind of organization it is, how big the hospital is. So, like when I research, I mean, all the awards that Leah mentioned showed up, and it was so impressive to me. And for me personally, I don't want to work in a small hospital. Like by working at the hospitals and like with a lot of facilities, I can like enhance my experiences as well. So it's the reasons why I chose Mercy.
Perfect. Thank you so very much. So sounds like you had other opportunities that were presented to you and you chose Mercy, and sounds like you are thriving there, having a lot of fun, loving the seasons, loving the Clydesdales, all that great stuff. But that's wonderful. You know, I think that's really important that you may be presented with a number of different opportunities, which is really important to do your research, work with your recruitment team, and work with your support team here at AMN Healthcare International to make sure that you're making the right decision. You certainly made the right decision in choosing Mercy South. Wonderful place to be. And so thank you for that, Theory. Appreciate that.
Yes, I can see that. Yes.
Oh, absolutely. And you'll probably stay, you know, I mean, it's a beautiful place to be. And it sounds like you're doing amazing at work and have created, I'm sure that you've made many friends working there at Mercy South as well, because they're so welcoming and I'm sure they make you feel right at home. Leah, why did you choose to work with AMN Healthcare International to recruit international nurses, and what has your experience been?
Yeah, I mean, overall, our experience, I think I can say, has been very positive. You know, Mark mentioned our president, Sean Hogan. He had this vision, really even before the pandemic, to expand our recruiting efforts for nurses. So this was set in place years ago. We've been on this journey now since then. And truly, AMN, their values partners really closely with ours. And the relationship between us and AMN is incredibly positive. And they have really helped us along this journey, and we're well established. And it's really wonderful to be a part of, truly.
Well, thank you so much, Leah. I appreciate that. And we got a question here in the chat, and I direct this to either Mark or Leah. Do you have an OB/maternity unit?
I can take that one. We do, and we do have a few international nurses in there, but usually we like to get people started on the more of the inpatient side, the med-surg side. But I think what's great about Mercy South is we're all about growing you to where you want to get to. So if you have a dream to be in OB, maternity, if you have a dream to be in critical care, surgical recovery, ortho, neuro, wherever your dream is, we like to get you established and then start growing you into that. So there's tons of options just within our own hospital. And we've had quite a few nurses who have started in med-surg and they've gone to critical care. We've had a few that have started in med-surg and gone to LDRP. So it is available, and if that's your dream, we hope to get you there.
Perfect. Thank you so So hopefully that answers your question. I see a couple of questions to address around English and PTE. So PTE in the state of Missouri. And so what I would encourage you all to do is, prior to taking your English exam, do your research as to where the English exam that you are choosing to take is accepted in the United States, because not every English exam is accepted in every state. So we want to make sure that you are educated on that. So PTE is not recognized in the state of Missouri. IELTS is. So if you take IELTS, you're going to have a lot more opportunities. That is recognized in more states. But again, you choose what English exam you want to take. We will certainly help you in that area. We do have an English preparation program that we can introduce you to. But again, just be mindful that the English exam that you choose to take may not be accepted in states where you want to go. So please, questions, ask us. We'd be happy to share that with you as to where each particular English exam is accepted. So thank you for those questions. I just want to make sure that I addressed that. Hi, Jan. I see you, nurse from London. Welcome, welcome. Thank you so much. And we have a question here. Do you have a hemodialysis unit? And then we're going to get to Mark on another question.
We do, yeah. That's underneath the critical care service line. We have 6 bays, and then we do portables at the bedside in the critical care areas. And we also do peritoneal dialysis as well.
Perfect. Thank you so much, Leah. So Mark, what do you look for in a nursing candidate? We know that we need to work in certain units, but what else are you looking for in?
So I think I can speak for Leah too. I think we're looking for passionate people who are open to learning. So much of healthcare has become a service-based industry. So patient focus, patient experience, really putting that patient at the center of the work, and then working well with coworkers, being flexible. There's just a ton of opportunity here, and what we really hope to get are nurses who are engaged, nurses who want to grow, and nurses who just really love the job and the career for what it is, of helping people. We have a lot of people that come from outlying communities that need a ton of help and support, who have barriers such as, financial barriers, you name it. So we're really here to support them and get them to the best point in their life, health-wise. So if that's really what you're about, that's what we look for.
Perfect. So if I'm hearing it correctly, you need passionate individuals, which I know are international nurses, just like Theory. This is a lifelong dream and come with a lot of passion, dedication. So, bring a positive attitude, I think, is going to be also very important. Even though this is something that you have been dreaming of and looking forward to for a long time, it can be very challenging to transition. Things are different here in the U.S. Than they would have been in your home country for the most part. I myself am an immigrant. As I said, I just got back from Ireland last week from visiting my family, and I've been here for quite some time. I won't age myself, but I've been here for quite some time. But it's challenging, and there are still some days where you get homesick and, you miss the things that you grew up with. Of course, you're going to miss your family if they're not with you. But I would have really loved the opportunity to work with an organization like AMN Healthcare International to help with those things. So there's the transition of practice in your job, right, as a nurse, but there's also that cultural aspect and that social aspect that's so important. It's just as important that you are enjoying your life outside of work. Yes, we want you to thrive and prosper at your job, but also outside. Theory talked about the things that she gets to do outside of work. And that's really, really important, that you have a partner who's going to help you and connect you with that international community in your location. So thank you so much for that. Mark has a question on how can we apply. Very, very easy. go on and apply at amnhealthcare.com/international. That goes directly to our recruitment team. They are on hand after this event to expedite any applications that we get in as a result of this amazing show. If you have already applied, please be patient. We get a lot of applications, and our recruitment team is working through them diligently to make sure that we get to you in a very short period of time. So yes, Mark, apply today, get your place in line. Right. So that's going to be really important. And Theory's nodding, as soon as we can get that I-140 applied for you, then that secures your priority date. So that's going to be very important for you. And that's the first thing that you need to do, right? Whatever's going to happen externally is going to happen, but that's the thing that you can control. You can decide today to take control, submit your application, get a few documents in, and you can have your I-140 filed in less than 30 days. So that should be your motivation. And if you take anything away from today, and I know that we're going to have a lot more information from the Mercy team, is get your application in today so that we can start your process of working with this amazing health system. So Leah, can you talk to us a little bit about what orientation for an international nurse looks like?
Yeah, so one of the reasons why, the program here at Mercy South is so special is we truly treat our international nurses just as any other Mercy nurse. So you are a Mercy nurse as soon as you start here. And you're put through the orientation and fellowship or residency programs, as we call it, for whatever service line you are in, whether it's med surg or critical care or ED. And we help you along the way. Most orientations take, I would say on average, 10 to 12 weeks. If you need a little bit more time, we can, work that out. We do have clinical nurse educators for every department that will be working with you along the way. And then we work really closely with AMN if you need any other additional support from a cultural aspect throughout your orientation as well.
Perfect. So it sounds like our international nurses get a lot of support from day one and right through their entire assignment and thereafter as well. So I love how you said, Leah, when you're a Mercy nurse, you're a Mercy nurse. And so I think that that's really important. And our nurses want to feel part of a family, and they certainly get that at the Mercy Health System. So thank you. I do want to, there's a question here. Do you accept non-bedside nurses? So right now, we are looking for experienced nurses who are working at the bedside. That is going to be very important for a successful transition here in the US. So if you are not currently working, I would urge you to go back to bedside, and then we can certainly help you. But right now, no, we're looking for experienced nurses who are working at the bedside, and that's what our hospitals need. That's what our hospitals are looking for. So if you are not currently, I would highly encourage you to go back bedside, and we would be more than happy to help you. So Theory, can you talk to us a little bit about what was it like in your first day or days after you arrived in the US and started working at Mercy South? And how did AMN Healthcare International support you?
Let me start from the day when I arrived to the States. So I didn't feel like strange at all because there was one licensed person there to guide me through how to get the bank accounts, how to get the phone card, and like they would drive me around where to shops, the grocery and stuff. And when I started onboarding with the Mercy, it was so detailed and so well programmed. Like I have all the classes and stuff. Although I have been a nurse for a long time, I mean, the process, the devices that we use, everything is different from what I have experience with. So it was really helpful for me. There are like all the detailed classes that I needed for my like for me to work in my surgical step down unit. I have to share those the rapid response team. I have to shadow the tele unit, so I know what is going on and what they do. It does help me a lot when I walk on the floor.
Okay, great. So the orientation was robust for you. You talked about how it was different from practicing nursing in your home country. Can you talk to us a little bit about what those differences were between practicing at Mercy South and practicing in a hospital? I know you mentioned that you had worked for many years in Singapore. So what was the main difference there?
We use Citrix for the charting, for the documentations, and here we use Epics, which is a huge difference for me. And the way we contact the providers, how we escalate, our concern to the doctors as well, and the autonomy of the nurses. Like there are a lot of things we cannot do as a nurse back in Singapore, but here we can do a lot of things as a nurse. How to advocate for your patients, how you can do assessment of patients, and how you can decide on the patient's care, how you can involve the planning of the patient's care. They are all like a huge difference for me.
Perfect. Thank you so much, Theory. So I just have one more question for the panel is what advice would you give to international nurses who are listening in today and want to get started on the process? What advice would you give them? Theory, let's start with you.
Okay, the first thing for me is that if you don't know how to drive, please learn how to drive here. I mean, it's very difficult to like rely just on the public transport. So it is always a very good to learn how to drive first. I was lucky enough that my husband was with me to drive around. If not, I would be in big trouble. Yes.
Okay. Have you started on the process of learning to drive
Yeah,
yet?
yeah, I'm driving now, and so it's a huge
Congratulations.
thank you.
Congratulations. That's wonderful. You know, that's a big deal for someone
Yes, it
coming
was.
from international. It's a big deal.
Yes.
So congratulations to you. You are mobile. So that's great. It just gives you so much more independence, doesn't it? Like
Yeah,
you can pick up
that's
and
right.
take off and go enjoy your new area when you're not working. There's one more question from Pretty Mel. Are we looking for emergency room nurses at Mercy South? Leah's nodding her head. Yes.
Yeah, as far as I know, yes. I think we have a couple.
Okay, perfect. So, what you're going to do is submit your application, and our team will go through the available positions for you at Mercy South, and if there is an ER opportunity and you qualify for that, then absolutely we'll get your application submitted. Leah or Mark, any other parting advice before we leave you go for our audience today? Thank you so much for all of the great information that you've provided. I know that it was very, very helpful for our audience here today. And we want to be very respectful of your time. But if there's any parting advice that you want to share with our audience, I know that they would appreciate it.
I think I'd just like to say be patient. If you do end up coming here to Mercy South, it is a major transition. We've learned, and kind of like Theory said, she made a good point, about the driving and the living situation. We're off the major highway, and what I learned from some of the international nurses is that they were trying to get as close as they could to the hospital because in their country the roads are kind of bad, and there's more of a travel aspect of getting to somewhere. Here, you can be miles away and it could take you 15 minutes to get to work. It could take you 20 minutes to get to work. So just overall be patient. I know nurses also we just have a nature about us where we like to accept a challenge and then get it completed as soon as possible. But I think transitioning to the United States and the United States healthcare is a little different. And you've got people who are here to support you and be patient. And to understand that you're trying to transition your personal life as well as your professional life. So, take the time, get set up appropriately, and I think it'll be a smoother transition for everyone.
Great advice, Mark. Thank you so much. Leah, any last advice before we let you go?
Yeah, I mean, everything that Mark said. And then also, I think we've already mentioned it, but just do your research with, living areas and options here near the hospital. I think we had some feedback at one point in time that the living expenses were too high, but they were looking in a very, very prestigious area near the hospital. So there are other options. So if you are finding any of those barriers, please reach out. I know anybody at AMN or Mark or I or anybody here at Mercy South can kind of help navigate you guys where to go and where to look for. Another thing I wanted to add is, we've had this international nurse program for several years now. It's pretty, I want to say well-oiled, right? So we have all of our processes down. And then I wanted to add, many of our international nurses have already converted to core after their contracts have been completed. So I bring that up because we do have quite a diverse population here of coworkers here at the hospital, and then also here around the hospital is diverse as well. So.
Perfect. Thank you so much, Leah. And I know that's the goal, right? Is once you come to Mercy South, you want to stay at Mercy South as a core team member, and the team does a great job early on in your process in ensuring that that's something that you choose to do. And Theory's nodding her head. So I do just want to say a big thank you to our panel today. I know that all of our listeners have gotten some great information, not only on the health system, Mercy South, but also Theory's experience as an international nurse in St. Louis, Missouri, working at Mercy South. So thank you so much. Again, we want to be very respectful of your time. We look forward to having you on a subsequent show. Hopefully that you will be open to that. But really appreciate all of your time. And Theory, I think you're on a day off, so I appreciate you taking this hour just to spend with us. And I hope that you all have. Oh, I'm sorry. Can you say that again?
I just come back from my night shift.
Oh, Theory. Now that's dedication that we were just talking about, isn't it? Like, I mean,
I'm really glad that I
oh my God.
Yeah.
We cannot thank you enough for that. So hopefully you get some rest, some well-deserved rest today. And if you all have any weekend plans, I hope that you have a wonderful weekend. The Olympics opening ceremony is tonight, so I will be watching. And hopefully I can stay awake for it because it's pretty late. But looking forward to that as well. So some really good sporting activities coming on over the next couple of weeks. My personal favorite is the gymnastics, but so we'll be listening in and watching that. So, okay, thank you so much. Again, we appreciate all of the great information. Looking forward to seeing you all again soon, and have a great weekend. Okay, thank you so much. All right, so I think that you had got some great information there from our hiring leaders. I see a lot of questions coming in. Our team will be in there throughout the day answering everything that we can on our Facebook page, but we want to continue our show, and our next segment is one of our favorites. It is Holly's Clinical Corner. Now, Holly is not able to join us today, but she has very sweetly recorded a video that we are going to share with you right now, and Holly will share her Clinical Corner with us. So let's bring it up.
Welcome to today's Clinical Corner. My name is Holly Musselwhite. I'm the Senior Clinical Manager with AMN International, working with direct hire nurses. And I want to talk today about clinical decision-making or clinical judgment. It's a critical part of the nursing role here in the States. Mistakes can happen when we don't do this effectively, leading to patient injury or death. Nurses in this process are going to recognize cues from their assessment, which includes listening, looking, feeling, doing that entire head-to-toe assessment, analyzing the information, and coming up with what is the likely problem and what are the priorities that we need to do so that we take the right action. Follow-up of evaluation of the actions we took and what the outcomes were is also an important part of the process. So just because you took action doesn't mean you're done. You have to keep looking at what happened after that. How can we learn from it? How can we keep striving and doing better? Novice nurses take a long time for this process. So beginners are doing a very methodical step-by-step. Did I do this? Did I do this? Do I know that? Should I check this? And it can actually lead to a slowdown in taking action. Novice nurses are best benefited if they actually seek out the seasoned nurses and use some of that dialogue with them to validate that they're on the right track and their clinical decision-making process is moving in the right direction. And that positive reinforcement or the provision of suggestions from that nurse can actually help us pivot and continue to polish those skills. Seasoned nurses rely on more intuition because they've seen a lot of things and they're recognizing patterns that they can apply to future scenarios with patients. So they have that going for them. But if you lack knowledge of fundamentals, anatomy, physiology, pathophysiology, basic treatments of common conditions, it's time to start refreshing those. You may even find it helpful to pull out your NCLEX study materials because that is that basic entry-level nursing knowledge. And if you've forgotten that, it's time to refresh before you get here and you're called upon to know that information as a way of executing good clinical judgment. So understanding common conditions, best practices, and then refreshing what you don't remember is going to be critical to preparing so that you have the best chance of being set up for success. That's it for today's Clinical Corner. Good luck in developing your clinical judgment skills, and we look forward to talking more next time with you on the Clinical Corner. Have a great rest of your week. Bye-bye.
Great. So thank you, Holly. Holly always has some great information, great advice for international nurses. So I know that it's one of your very favorites. Hopefully, Holly will be back for our next Onwards and Upwards show. There are lots and lots of questions that are coming in the chat. And again, the team will be in there throughout the day answering what we can for you. Love to see the interaction. I see Arlene, ER nurse here. Thank you, Arlene. Vincy Daniel, do we hire critical care nurse? Yeah, Leah is the executive director of the critical care department at Mercy South, looking for critical care nurses. So the answer is yes. So before we move on to our upcoming shows, I do just want to say again, this is your opportunity to get your place in line. Please don't delay. Do it today if you have not already. The first step that you have control over is getting your I-140 applied. So the sooner you do that, the sooner you can establish that all-important priority date. And regardless of what happens with the visa bulletin, you want to do that. So that is what you can control today. You will get your I-140 filed in less than 30 days by choosing a staffing opportunity. And you don't have to choose a location right now, although we highly encourage you to choose Mercy South and go work with this amazing team that joined us today. So let's pull up our upcoming shows and we'll let you know what you can look forward to. And so we have our immigration Q&A on August 16th, excuse me. And so that's your opportunity to hear from our lawyers and any questions that you may have. So please tune in on August 16th for our immigration Q&A. On August 13th, we have the LaFora talk show, and we want to hear from you. So what do you want us to cover? What information is going to be important for you? So please make sure that you are putting in your suggestions, email us, message us on our social media pages, whatever you need to do. We'll take your recommendations, and then we will get that information out to you. So we got our NCLEX class, which is the first Monday of every month. And we've got our Aspire RN, the third Monday of every month. And then we've got our 2 English shows, the second Monday and the fourth Monday of every month. So lots and lots of great stuff that is coming up over the next couple of weeks, over the next couple of months. So again, we thank you so much for joining us today. I hope that you found our client showcase with Mercy South very, very helpful, inspirational. As I said, our recruitment team is on hand to facilitate and expedite your application so that we can get you in front of those hiring leaders should you qualify. But again, get your place in line today. It is, I'm repeating myself, and I know I'm repeating myself, but it is very, very important that you take control of that, establish that all important priority date, and then let us guide you through the rest of the process. Okay, so with that, I will let you go until the next time. Onwards and upwards.